One of the things I talk about often when you're doing an Invisalign treatment is to try to find movements that play to the strengths of the aligners. Anyone who has a lot of experience with clear aligners knows that extrusions can be challenging. And so I want to show you a case that came across. It was a relapse case of someone that I treated many years ago. I wanted to give him a low fee, and he was really not a high maintenance person. He just didn't like the gap that was opening between his front teeth, and he didn't like the lower crowding. And you see both of these things here. So I want to keep this to a small aligner count. I want to give him a low fee, and I chose Invisalign Express 7 aligners. But I want to show you the Clincheck that came back and the Clincheck that I modified. And I want to show you a couple of things. First of all, if you look at the photographs, one of the incisors is short. You see in this picture a little bit more where it's somewhat shorter. There is a cant to this plane. I don't remember how the patient finished. And so I want to show you how this Clincheck is coming back. And look at the extrusion, especially of the canine and the lateral. You see this right here? Now, for that to happen, you also need intrusion of the lowers. And I'm thinking, can I get away without the vertical movements here to satisfy this patient's chief complaint? We already have a solid occlusion bilaterally. So that's one thing I'd like to do. And also note that the lateral incisor is clearly a short clinical crown. And so bringing this tooth down would make the gingival margin show. I can't show you the smile line here because of patient confidentiality, but it would make that gingiva come down into a noticeable position. The patient's lip line is sort of right here. You can't even see this gingival margin. I don't really want to bring that down, and it's hard for aligners. So that's one thing. And again, you'd have to intrude the lower and extrude the upper, because if you extrude the upper, even if you could, it would bang against the lowers. The other issue is with regard to the space. This is a really subtle thing, but this is what you have to look for in Clinchecks. So to close the space, watch how you'll see the crown tip over a little bit to close that space with some extrusion. But if you look at the incisal edge, and then you look at the gingival margin and trace the root, just imagine where the root would be. There's a slight bit of distal root torque. But in this modified version, do you see how the root is not moving as distal? And you see it here. It's very subtle. And also in this new plan, you see no extrusion of the canine or the lateral. Now, what this will mean is that in your final Clincheck, you've addressed the chief complaint. You've straightened out that lateral on the bottom, that canine on the bottom, but you didn't intrude as much, and you still have a reasonable height. You can maybe reshape that a little bit. We close the space, and now that short lateral, guess what? It's a really short tooth. If you want this to be long, orthodontics is not necessarily the answer. It's hard to do. It would bring the gingival margin down. Tell the patient they need to have bonding on this tooth to lengthen it, or a veneer. So now what I've done is I've addressed the chief complaint. And the thing is, if you had those extrusive movements and they didn't play out, then the aligner would lose its grip, even on the surrounding teeth, or it would be uncomfortable. You want everything to track. So I think the message here is, in cases, you're trying to keep the movements as simple as possible to address the chief complaint. And now for anyone who says, oh, this is doing orthodontics, that's not sort of comprehensive. Okay, well, if this was a 10-year-old and we had treatment time of 2 years, or if we were going to use braces, no problem. But we have to be practical with adults. There's no harm in keeping the current comfortable occlusion for this patient and achieving the chief complaint correction.